patient with the initials of ER was admitted to the hospital on September 22nd of 2019 with a primary diagnosis of PVD with lower leg claudication. The patient also had some secondary diagnoses which consist of chronic atrial fib, systolic heart failure, hypertension, type 2 diabetes, and Alzheimer's. On September 25th, the patient ER was going to receive an angiogram around 1400. So I got to sit down and talk a little bit with the patient, and she told me that she was a smoker, which definitely will come back around later. She had pain with walking in her lower left leg, and she was alert and oriented ×2, probably due to the fact that it was still early in the morning and maybe a little bit of her Alzheimer's. While doing a physical assessment on the patient, it became evident that she had some signs and symptoms that correlated to her primary diagnosis. So those being that the loss of hair on her legs, so her legs look very shiny, very thin, and she had a weak pedal pulse, and it was mainly on the left side but a little bit on the right. She had blue coloration of her skin as well. So there are a few risk factors that ER really displayed that relate to her primary diagnosis of PVD, one of them being that she has hypertension. She is not very active, and she is a smoker, which once again we'll come back to. She has high blood pressure and she has diabetes. Some other risk factors that go along with PVD that this patient did not display was obesity. She had a BMI about 18, so she was more on the underweight side than she was on the overweight side. And then also the fact that she had no family history of any arterial disease noted in EPIC, as well as a verbal questionnaire. So then we look at the signs and symptoms of PVD, which really display numbness and tingling of the legs, burning or aching in the feet or the toes, and a change in leg color, temperature, and hair loss. I used the resource, which is an article written by Dr. William Krupski, and that's basically talking about how cigarette smoking heavily associates to diagnoses that correlate with atherosclerosis. So in this case, it fits perfectly with PVD and what ER is definitely experiencing because she is a current smoker. Smoking reduces the amount of HDLs that we can have in our body, and those HDLs are those healthy cholesterol in our body. And we want to have more HDLs than LDLs. Then we have our famous lifestyle changes that we pretty much see universally throughout a lot of these chronic illnesses. So exercises, different diet, smoking cessation, which is really a big key for her. Then the healthier diet that she should focus on is reducing some fats, sugars, and red meat, and increasing her fruits, veggies, and fish. The next thing that we might recommend for this patient would be some medication, and this could be statins that would help lower the cholesterol for her, some vasodilators because she is a smoker, so we really want to try and reverse the effect of the smoking, and some blood thinners. A vascular test, so maybe doing some capillary refills on her toes and gently just pressing throughout the lower leg around the calf region into the foot to see where the most tender spots are. Potentially an angioplasty, which is when they place the stent in the area that is causing the most claudication. So a lot of the education for this patient would just be how her smoking habits definitely contribute to her PVD, and just explaining a little bit of the anatomy behind it on the vasoconstricting, maybe giving more visuals depending on what kind of a learner she is. The difference between PAD and PVD, he gave us a really good visual that talked about the difference of PVD, which putting our legs up, or PAD, which dangling our legs is better for our patients. So reminding our patients, regardless of which one they have, that it's really important to follow those instances.